welcome back. So we want to start our video discussion today with a talk about codes of ethics and scopes of practice. But before we get into the discussion, I'd like to introduce you to our subject matter expert who's going to sort of help with the discourse with this course. And this is Miss Amelia Mitchell, who is the owner of Alchemy Healing Arts Center in Annapolis, Maryland. So Amelia, you want to just kind of give a brief introduction to yourself?
Absolutely. I have been a massage therapist for, I think it's about 14 years at this point, licensed massage therapist here in Maryland. I love the community college education system, so that's one of the reasons I'm a big fan and I'm here. I own a practice in Annapolis, as Robin said, and my specialty is lymph drainage therapy. So at this point, after all of these years, that's pretty much what I focus on, in addition to teaching and all sorts of other fun things like being involved with AMTA.
So I want to kind of ask you before we actually get into ethics. So what is it about ethics that kind of intrigued you to want to be a part of this online course?
I started out learning more about ethics as I learned about healthy boundaries. Mm-hmm. And that was something that the old adage about you learn what you learn what you teach, you teach what you learn. Mm-hmm. And I really needed to spend some years learning how to improve my boundaries. Mm-hmm. And in that, one runs into a lot of ethical concepts. Sure. And it really started informing the ethical conversations that I was having with other staff members and students and things like that. And gradually it developed into, I really enjoy this stuff and I love these conversations because, frankly, ethics is not black and white. No. There's a lot to talk and consider, and playing with different frameworks to figure out what a good decision is has kind of turned into one of my things.
Yeah. Which is why we came up with the title of the course is Ethics for the Modern Massage Therapist, because things have changed so drastically with regards to ethics in the practice of massage therapy. So let's kind of delve into this a little bit. Let's talk a little bit about scopes of practice. So what does scopes of practice really mean?
Well, we come out of massage school and we have a good understanding of basic massage techniques. We are qualified to do a Swedish massage. We've got some deep tissue experience. Depending on the school, you may have delved into myofascial or gotten some oncology training at a great school or something like that. But your scope of practice is relatively limited to what you have learned, what you have actually mastered and you're qualified to do. Proficiency, yes, that is a very good educational word.
I'm going to do that a lot to you.
Oh, please, I don't mind. So, scope of practice is one of those things that's hard to define because my scope of practice is different from your scope of practice, is different from everybody else's, because it is what we have individually been trained in and developed a proficiency in. So it's not okay that I took a course on trigger point 15 years ago and I've never used it again. It's not okay for me to say that that's part of my scope of practice at this point because it's been so long I don't even remember it. Mm-hmm. I couldn't use it professionally. However, I can say that pregnancy massage is within my scope of practice because I'm certified, I've taken advanced courses in it, and I have practiced it over the years.
Right.
So it is a very individual thing, scope of practice, and we each need to essentially discern what our own appropriate scope of practice is as a professional.
Right. So basically, it comes down to a few main points, which is proficiency of baseline skills.
Yes.
So that's when we originally are licensed or, as massage therapists, when we come out of school, and those are the basic proficiencies. But then you obtain higher levels or advanced levels of proficiency through extensive educational training, but also practice. It's not just taking a class and being able to offer it on your menu of services like the very next day. Just because you mastered that certification, you passed that exam, doesn't make you proficient in it just yet. So what would you just suggest with somebody who does do that? So, like, for example, I just recently completed my manual lymph drainage certification, or maybe somebody's completed a hot stone certification. What would be a good rule of thumb in terms of going from, I just learned this new technique, to being considered proficient?
I think that's a wonderful question, because we're all in that place at times, and most manual therapies are things that you can integrate into work that you're already doing.
Right.
So we'll do manual lymph drainage because we both know it well. That's something that you can integrate into a regular massage. For many years, that's one of the things that I was doing side by side with doing distinct lymph sessions. So you've got somebody with a bum shoulder. If you open up that shoulder with lymph drainage before you do all of the other massage techniques, you're actually going to have more successes.
Right.
So gradually building that into your practice and doing distinct lymph practice sessions for a while is what I would suggest. So you can be learning and practicing on your clients. That's the beauty of being licensed, is you actually have bodies that you can practice on while you're doing their sessions, not turning it into just a practice session. But then for something that is completely new, like manual lymph drainage is, doing actual practice sessions, getting friends' bodies on the table so that you can focus and do it yourself. And really, I need to practice the leg protocol a few times. You get to do that in that setting.
Right, right. You know, and I've done that in the past. Like when I've learned, when I first learned hot stones, a lot of times I never offered hot stones as a initial offering that I charged more for the service. A lot of times I used to do it as a promotional type of thing, where I would offer free hot stone massage add-on in addition to their regular session. And I did it for a couple of months just so that I could get some more practice in it. So, you know, then once you feel like you're pretty comfortable with it, then okay, I can now charge more for that session, ethically speaking.
Exactly.
Because I've mastered and I feel like I've done what I've needed to do and applied the training I've learned.
And I've had hot stone massages from people who are very competent and people who are not. And it would be not a fun thing to pay extra for somebody who is fumbling stones all over the place.
Yes, yes. And I did do that in the beginning. I think we've all done it.
Yeah,
right.
we all do.
Exactly. So, okay. So completing those certifications, allowing yourself that time to practice for a few months to sort of integrate it into your toolbox as a massage therapist, if you will. Okay, so that's sort of some good places to sort of stay with in terms of scope of practice. I want to touch upon two other things before we move on to code of ethics. With scopes of practice, I want to talk about entry-level education too, because I mean, I teach entry-level education, but one of the things I tend to find when I go places, when I get massages, that there's people who, they list all these different proficiencies of skills that they have. Now, I do this as an educator where I'll expose my students to different types of things like zero balancing or craniosacral or prenatal massage, but we clearly don't teach that completely in our program. Our focus is on entry-level education, which is, you know, what the requirements are of our accrediting body and, you know, the national licensure exam. But yet so many people think that they have mastered these techniques. Where do they get these ideas from?
I understand too. Back when I was in massage school, and it was probably similar for you, once I got to the last semester of school, we did lots of intros. Same thing. We did intro to craniosacral, we did myofascial, we did all of these different things. And it was enough for me to decide, oh, I'm really interested in learning more about that. But it wasn't enough for me to say, oh, I can do this. And people really don't seem to understand that this is sort of a smorgasbord of these are all sorts of cool things you can do in massage. Now go learn more. So when I see somebody with 50 qualifications, I tend to be a little skeptical because it probably doesn't mean they've gone that far. And there are a lot of classes you can take 4-6 hours for pregnancy or something like that. As someone who's certified, I don't feel like that is actually sufficient time to learn how to do that modality properly and safely.
Right.
Right. So I'm kind of with you.
Right. Entry-level education, the whole idea is exposure to learn about continuing education, just like we're providing this continuing education course for you right now. It's the intent to give that exposure to expand your horizons of where you can go. So agreed. One last thing about scopes of practice. We've talked about skill sets and trainings and so forth, but what about licensure from different states? How does that play into scope of practice?
Well, different wherever you are practicing, and we are in Maryland, so we work within what Maryland says. Wherever you are practicing, you need to look and understand what massage therapists are allowed to do in that state. And that does change from state to state. It is not consistent across the nation. So you need to understand that I don't know this for fact. I'm just going to use cupping as an example.
Yeah.
Because cupping in some states is certainly considered within scope of practice for massage, and in other states it may not be considered within scope of practice. So while you may have the training, your licensure may not allow you to do that. Just like in Maryland, an RMP can essentially do anything, however, they can't do it within a healthcare setting.
Right.
They can train in anything, but they're limited. Their scope of practice does not include working within a healthcare setting. So that's just another kind of way to look at it.
Sure, absolutely. Okay, good. So I think we've kind of covered scopes of practice really well. So now, what does the Code of Ethics entail, or what does that mean for us? What does it signify?
A code of ethics is an overview of our moral responsibilities, essentially. And moral responsibilities can be somewhat personal, and they can also be broad. Within the massage therapy industry, they are essentially rules that we live by, ways of functioning interpersonally with our clients, how we treat people, how we do business, frankly. There are rules, there are standards that are guided by moral principles, which are essentially you treat people right, and the client's welfare always needs to come first. Of course, there are places we can talk about safety of therapists and things like that, but the overarching requirement of our ethical responsibility is to make sure that the client is thought of first.
Right. And then our professional organizations like AMTA, ABMP, NCB, TMB, they all have codes of ethics. Now, and from what I remember, and I believe that these will be posted for you on the site, that you'll actually have access to all of those professional organizations' codes of ethics. But what I wanted to kind of point out is that really those codes of ethics are written to protect the client more so than the therapist. But this other term, which we haven't talked about, which is standards of practice, that is really more the professional standard of how a therapist should act. Now, code of ethics clearly plays into a standard of practice, but really, do you agree that's kind of the difference between the two?
They can absolutely be seen as two different things. A code of ethics is part of what informs our standard of practice.
Yes.
And you can't have a standard of practice that ignores ethics. However, they are to some extent separate things we all need to be paying attention to.
Good. Okay. Well, I think we've pretty much covered this topic. Any other like little tidbits of things that you'd like to sort of leave with our viewers with regards to just standards of practice, scope of practice, and codes of ethics?
I think the only piece that I will add to scope of practice is an encouragement to follow your curiosity.
That's good advice.
Because if you're curious about something and you want to find out a bit more about it, it may end up being the direction where your scope of practice expands.
Right.
So that's really not an ethical thing, but it is in terms of building a practice, following your curiosity is a very good place to start.
Excellent. All right, so stay tuned for our next edition, our next video, where we'll talk about a different topic with regards to ethics. Stay tuned.